Everyone. I'm sorry it took a little bit of time to get started. Couldn't get the screen to work exactly how I want it to. So, but we're going to go ahead and get started. The title of February's presentation is What's the Heart Got to Do with It? And I'm kind of trying to play off of that old song by Tina Turner, What's Love Got to Do with It? And diabetes and heart disease, what's the connection? And of course, February is the Heart Health Month, so that's why we're focusing on the heart. And what I found, you might ask, some people have asked what diabetes and heart disease have to do with each other, because what I found in the last 7 years of educating patients on diabetes, that very few people realize that there's a huge connection between uncontrolled blood sugar and heart disease. And I say heart disease, we're going to use the word heart disease today, but we also mean vascular disease anywhere in your body. We'll talk more about that. But I just think it's important, especially during this month of heart health, to just reemphasize the importance of working on controlled blood sugar, and then you can actually realize other benefits specifically to vascular or heart. I have a guest host with me today who's going to shed more light on the connection between your heart and uncontrolled blood sugar. While we're waiting for everybody to jump on, though, I found this risk calculator. The website's at the top, highlighted in yellow. That's the website at the top, the yellow, the cvriskcalculator.com. You can put in whatever you put in your parameters, put in someone else's parameters, your spouse, someone else that you want to check on. You can put in any parameters you want, and it's going to calculate your risk for the next 10 years of possibly progressing to having some kind of heart disease. The next screen is just an example of the summary you're going to get. And what I thought too is, put in what your summary or what your parameters are with your blood pressure, and do you have diabetes? Do you have heart disease already? Cholesterol and all that, and then change the numbers. If you changed them up, what if your blood pressure got worse than what it is right now? What if it was better? It's going to change that percentage at the top. And I think some of the things and that these this parameter, this risk factor, I guess, has some limitations, because it said it's not there's insufficient data to reliably predict risk for those that are less than 40 and greater than 79. So that's why that age gives you that age range. So, there are some parameters there that might not work for you, but I thought it was a place to start. And I just wanted to, it's one of the resources at the end of the presentation also, so you can always look at it later. I want to remind you, we're really trying to encourage participation this year as we have our virtual meetings. Remember, you can always send us a message through the chat option. You can raise your hand to actually unmute yourself and give us, an actual verbal live question or concern that you have with what we talk about today. Then we always have resources at the end of the presentation, and we want you to download these resources. You'll find them at the list. Usually they're right next to or right above where you can type your chat question that you have, and you'll find them there. The next, my mouse is not working. It's not going well today. So one thing I said last month was that every month I want to have something that actually focuses on your patient information, where you start gathering that information so that you're more aware and you can have an actual better conversation with your provider at every office visit you go to with your doctor or nurse practitioner. So January, it was all about getting serious and about self-managing diabetes. And that theme of getting serious about managing diabetes is going to continue the whole year, but February is about knowing your numbers. So there will be, again, a resource so that you can download this, or you can print it off, however you want to do it. This is focused more on, of course, heart health. It does information about diabetes, like what your A1C is, and what medications you're on, and are you checking your blood sugar, are you monitoring? But then I go right into heart health. So if this information you do not have at home, or you're not aware of, these are the questions to call and ask your provider or your provider's nurse, one of our care coordinators, if you're a patient at Valley Professionals, or the next time you go to the office visit, when they talk about this, write it down. These are important. This is important information that you need to be aware of. The more you know about your numbers, the more you're more knowledgeable, able to do something about them. We're going to talk more about some of these things with our guest host here in a second. I want to introduce her. So I'm going to give Jana Smith a little bit of time just to introduce herself. She's going to tell you more about her experience. The MSN after her name means she has a master's in nursing, and the RN means she's a registered nurse. But beyond that, she's been a nurse for many years, but I'm going to let her share that. So Jana, if you'll just take a few minutes and tell us your experience, and then I know you have a lot of experience with cardiology, so any information you can give us gives them an idea of why we brought you in as a guest host this month.
I'm going to unmute. Let me know if you get feedback. My name is Jana. I was a registered nurse at Union Hospital Terre Haute on the cardiology unit since 1985. So I've been a nurse for 37 years. I did do the program at Union for heart failure because it was one of the most frequent readmissions. It was also one of the most common diagnoses leading to early death or an increased mortality. We'll talk more about that term a little bit later. Following Union, I became a director of nursing at a rehab facility, and for the last 5 years, I've been a patient care coordinator here at Valley Professionals. I also teach bioethics at St. Mary of the Woods adjunct, which means part-time, just kind of as a side job. So I'm excited to be here. I got into nursing because it's my alternative to medical school. Always wanted to be a pediatrician, but I wanted to be a mom more. And nursing gave me kind of that freedom to do both a little bit better. Really became interested in the heart when my brother had a massive MI at the age of 24, led to cardiomyopathy, eventually a heart transplant a year ago. So this has touched my family pretty closely. So hi, everyone.
Okay, good. All right, well, we're going to get started on what does heart disease really mean? I know in the medical field, we throw around a lot of terminology that maybe other people outside of the medical field, they don't even know what that means. So these are some of the other words that we'll use for heart disease. So if Jana, if you would kind of go through each one of those. And I took, so the notes that I believe that you sent, those are going to be attached also for everybody to download, and these same terms and definitions are going to be on there. So if you want to hear, or if you want to take notes now. But what's coronary artery disease?
Coronary artery disease happens when you get blockages in the arteries of your heart. Coronary means heart for most Greek studiers of the English language. Those happen usually from a buildup of plaque, or you can form a clot which momentarily or permanently blocks blood flow, leading to a heart attack, or angina, which is pain due to blockage. You can also get blockage, though, anywhere in your body, which leads to kind of side effects from coronary artery disease. If you get it in the carotid artery in your neck, that's what tends to cause strokes. If you get it in your legs, that's where you get the peripheral artery disease, which is very common in diabetics. You get neuropathy, you get a sore on your foot, you don't know you have a sore, you don't have good blood flow. It's kind of the perfect storm for a lot of problems. Going on, the next thing is heart failure. Heart failure happens when your heart muscle becomes weak. This can be from uncontrolled diabetes. It can be from uncontrolled blood pressure. You can have a viral illness. Matter of fact, we're seeing it a little bit post-COVID in kind of the new area we're studying. You can also get heart failure from actual sadness. Stress has been strongly induced to cause a certain kind of weakness. It can lead to actual heart failure. So don't think your mind doesn't play a part in your health. Blood pressure is another thing strongly associated with coronary artery disease. And sadly, with our current lifestyle habits that we all do, which is basically food high in fat, high in processing, high in salt, we're seeing increased numbers of high blood pressure patients at an earlier, younger age, and a lot more females than we used to. High blood pressure over time damages your arterial walls. It can lead to aortic aneurysm. It can again lead to strokes. It can lead to renal failure and a whole gamut of other diagnoses.
Okay, so a lot of, again, medical terms there, but these are some of the terms that your doctor might use in the office when you go to your office visit. We just want to give you a general overview. And when Jana was talking about arteries, yeah, like she said, they're all through your body, but the arteries are the vessels that carry the blood to your body and to the heart. And if those get blocked in the heart, then that's when you're going to have that blockage and heart attack, or and if they get blocked in the brain, we usually call that a stroke. So we're going to actually look at some pictures kind of to give even a better understanding of each one of these. So coronary artery disease. Jana, as you look at this, what would help somebody understand better what coronary artery disease is?
What I like to do when I talk to patients, if you look at the picture on the right that shows the narrowing of artery, kind of picture yourself at breakfast. You're frying some bacon and eggs because we all like bacon and eggs. You let your skillet kind of cool off before you wash it. You have to scrape the grease, the white fatty grease out of the pan before you can clean it. That bacon grease that's solidified at room temperature is the same cholesterol that solidifies inside of your arteries. It actually looks like a slab of butter. Butter's another one of the fats that we consume that can lead to the blockages. So that kind of gives you a picture. And now my brain, when I make bacon, which I like bacon like the rest of you, but you know, once every couple weeks is a lot better than every morning when you're worried about that clogging up your arteries.
So when it clogs the arteries, like if in the middle where we have the healthy artery, the plaque obstructing blood flow, and then the near complete blockage, like the near complete blockage, what's going on when that happens?
What's going on is the blood's having trouble getting through. So depending on which artery of the heart or in the body you're talking about, that's the part that's going to have damage. Because if you don't get blood flow, it doesn't get those vitamins and nutrients of your blood that keep it healthy and working properly. In the heart, we call it door to window of what time you get that artery opened back up. If you don't get it opened quickly, you get permanent damage to your heart muscle. That's when people start getting the weakness, the shortness of breath, the chronic chest pain at home. And in certain particular arteries, it can lead to sudden death because when it's blocked, it blocks the blood flow to the main portion of the heart, and the body does not survive without that.
Yeah, I mean, a lot of people, I think, forget, we know it, but we don't think about it. Blood is the thing that brings life to all of our cells. It brings the vitamins, the minerals, the oxygen, everything to our cells. And if blood doesn't get to it, those cells die. And that's when people will have pain, chest pain, if they're having a heart attack, or leg pain if one of their arteries is blocked. I mean, other things can cause pain too, but we're just talking right now about blockage of vessels. Okay. Again, along the way, if you have any questions, be sure to raise your hand and Haley will let us know or send a message through chat. So we talked also about another name of heart disease called heart failure. I know there's a lot on this screen or this slide. So again, I'll have Jana just kind of explain a little bit about heart failure. And it almost looks like it's a cascading thing that can happen, like something happens and it gets worse and it gets worse. But the thing I picked up on risk factors, that DM, that stands for diabetes mellitus. So that's diabetes right there. That's one of the risk factors for heart failure. But as you look at this, how can you help them understand this slide a little more? It has a lot on it.
And the best way is to think of your heart as a muscle. A muscle has to work strong to be able to pump your blood to the rest of your body. When that muscle becomes weak for whatever reason, you have issues or problems getting blood circulating where it needs to go. That's why some people get numbness in their feet, coldness in their feet. Sometimes dizziness is a side effect. Causes of heart failure can be multiple. It's listed up at the top, but basically CAD is coronary artery disease. CAH is usually arterial hypertension, which is high blood pressure within the heart itself. Autoimmune disease, people who have lupus or several of the other autoimmune, the body actually attacks its own healthy cells and it can attack part of the heart muscle. Valvular heart disease, you get when your valves start to leak. You often hear the terms mitral regurgitation, pulmonic regurgitation. Depends on which valve is affected on what name we give that. Like I said earlier, viruses can lead to heart failure and alcohol consumption. Over time, excessive use of alcohol causes heart failure and can lead also to your valves leaking. Several risk factors, not only diabetes, but obesity, which we will discuss what your weight should be a little later on. If you usually are anemic or run low hemoglobin levels, if you don't use that muscle, sitting on the couch is fun, but you're not getting any exercise to muscles by watching TV or working on a computer all day. Signs and symptoms of heart failure we usually watch for are weight gain, usually 2 pounds overnight, 3 to 5 pounds in a week, shortness of breath, brain fog, where you want to think of something and you just can't remember anymore. Sometimes that's your heart not giving your brain good oxygen. So part of our education is to teach you early signs and symptoms. We like to teach you how we diagnose, and we like to teach the things you can do to keep it from getting worse. The problem with heart failure, if you don't get an early intervention, you need to go to the hospital for some extensive diuretics, which are the medicines that pull the fluid back off. Those medicines are very harmful to kidneys. Over time, you see heart failure patients often go into renal disease or kidney failure, which will require dialysis. That can often be prevented if we have good management on the front end of this problem.
Okay. Yeah. So it in this picture almost shows, or at least the thing below it, it sounds like because of the causes and the risk factors that can cause this, it causes a structural change to the heart. And when the heart's changed or it can't get the blood out, it backs up.
Right.
And so there's this pressure, this difficult breathing, peripheral, and meaning in your extremities, and pulmonary, meaning your lungs, edema. And that means that you hold on to water. And that's why Jana said then you would take what we might call in the layperson's water pill. Mm-hmm. But those can be damaging to kidneys, is what she's saying. So, we're talking about diabetes and the connection to heart disease, but it doesn't just end there. There sometimes then are things that are risk factors because of all these things, and it can just build on each other, showing you the more importance of getting your heart healthy. And so why should we be concerned about heart disease? Or why should someone then with diabetes be concerned with heart disease? We talked a few things. I've got a blood pressure one. I must have put it somewhere else. I was going to put it here. But so we'll talk about blood pressure and why it's important, and some of those parameters, like you said, weight and what blood pressure should be. But since we're a diabetic group here learning more, why should someone with diabetes, even if it, uncontrolled blood sugar and just controlled, be concerned about heart disease then?
Uncontrolled blood sugars damage blood vessels. It's well known, statistically speaking. Also can cause inflammation inside the blood vessels themselves so that they don't work properly. They make it more prone to build up that plaque because you get irregularities in the surface of the arteries, and the plaque just likes to cling to those areas. It just leads to a facade, and usually diabetics also were more prone to some of the other comorbidities that go along with heart disease, like obesity, high triglyceride and cholesterol levels in your bloodstream. A whole cascade of things, really.
Yeah. I tell patients I meet with that a lot of times they don't think about that high sugar environment in the vessel doesn't belong there. Our sugar, glucose, really belongs in our cells for energy. When it's high in the vessels, it damages the lining of the vessel, giving those cholesterol as a place to really attach. Not only does it damage that lumen of the vessel, but also gives a place for those cholesterols to attach for them to do their damage. So, okay. And then also I found this in from the cardiosmart.org. I was just looking for some information. I found that diabetes increases the risk of heart disease 2 times more in men, and sorry women, but 4 times more in women. So it's just having diabetes can put you at a higher risk. And that's why, again, it's so much more important for you to have well-controlled blood sugar. Oftentimes I'll tell patients if they have well-controlled blood sugar, if blood sugar stays, our goal is 80 to 140, you can push back and you're less likely to progress to those other risk factors like heart disease. Okay, so another example, and you mentioned this before, but Jana mentioned that people with diabetes sometimes seem to also have high blood pressure, high cholesterol, lack of activity, overweight, and obesity. And when I first thought of this this specific slide, I thought, well, I don't want to say they're lacking activity or overweight or obese, because I realized there are a lot of type 1 diabetics who sometimes they're very thin, sometimes they are very active, but again, that they have a whole different thing going on with type 1 compared to type 2. But a type 2 diabetic, these are often what you'll see before they're even diagnosed diabetic. They'll have high cholesterol, they'll have high blood pressure, they will say, yeah, I don't exercise very much, and they will be overweight. Your body starts showing signs ahead of time, little red flags that you're heading towards diabetes with some of these parameters already, even before you're diagnosed with diabetes. So this quote kind of hit it home. Cardiovascular disease is a leading cause of morbidity and mortality among persons with diabetes. Jana used these words earlier. So what is morbidity compared to mortality? Those are some words they might not be familiar with.
Morbidity means your risk and rate of disease. So how likely are you going to be to get something? Mortality, sadly, means death from said disease. Yeah.
So that was from In Practice, which is a diabetic journal that I had, and I saw that for a cardiovascular article they were writing about. I thought that was eye-opening. What can make heart disease worse? If our goal is then not to have it, we're going to talk about kind of what can we do anything to make our heart healthier? What seems to be able to make heart disease worse?
Now, I think your next slide kind of spells them out. Stress, we talked about it earlier. Stress increases blood pressure. Stress damages arterial walls. Stress causes a whole facade of problems. It can also lead to weak hearts. Smoking, it's proven nicotine also damages the vessels, increases blood pressure, and makes you highly more likely to have a heart attack. Obesity, if you think about carrying extra weight around, that's more blood flow that needs to go to the part of the body because it's going through more density. Sedentary lifestyle, sitting on the couch, not doing the exercises, not moving around, keeping your muscles active. Poor diet is one of the worst. We spend a lot of time at Valley Professionals talking about how we can get healthier. We talk a lot about access to healthy foods, which up in this part of the county is quite difficult. Your resources are limited, but they are there. You just have to know where to look, how to look, and when the right time is to buy to stock up more cheaply. Excessive alcohol intake, again, is an important factor. I think we just need to spend a little more time on prevention. We have become a society where we take our children to the doctor for their wellness visits. We get to a certain age, we stop going. We only go when we're sick. We don't do the preventative things our doctor wants. We don't take care of the body that God gave us way back when. And then when something goes wrong, we freak out, we stress out, and we run to the doctor. But by then, a lot of the times we've been diagnosed with something that could have very well been prevented had we continued to see our healthcare provider. That's what we are here for as your medical home. We are here to take care of your body, your stress level, your addictions if you do smoke or drink excessively. And we can help you get the lab test and the testing needed early before the damage is done so that we can help you make the changes to be healthier.
Okay, so we talked about blood pressure earlier being an important or high blood pressure. And so I wondered if people always wonder, because I'll hear them as people come into their appointments, the nurse will get their weight and they hate that. Everybody hates that. That's right outside my office at Rockville. And everyone, even men, will say, no, do I have to do that? Do I have to get my weight? So, but I wondered if they ever wondered if they just think, oh, it's just something they always do. Why the nurse checks their weight and takes their blood pressure at every visit. Well, there's good reason why they're doing that. So talk to more about the weight measurement and the blood pressure checks, and what are the target goals that everybody, because again, that's on that patient information sheet. You got to become more aware of what your blood pressure is, what is your weight. I'm not sure if I put weight and BMI on there, but pencil it in, pay attention to that, and see if you can make changes so that it gets to the range that it should be. So I'll let Jana talk a little bit more about what those targets are for weight, BMI, I guess, and blood pressure. And what is BMI?
BMI is a calculation where we take your weight in kilogram with your height. It gives us a number, and mind you, a number is a number. You have to consider the patient as a whole as well. But basically, for a heart standpoint, your BMI should be between 18.5 and 24.9. And don't ever be afraid to ask the staff, hey, what's my BMI? Because when they punch in your weight and your height, it automatically figures that number for them. You can also Google BMI. It asks you for your weight and whatever measurement you get in your height, and it'll tell you that as well. Less than 30 is still acceptable for most people, but heart-wise, 25 to 30 is still considered overweight. BMI as a measurement tells us who's more prone for what ailments. And the ailments we're referring to here are the ones that are associated with obesity or an increased body weight. When I said take that a little lightly, if you consider a BMI on a bodybuilder or somebody who really works out at the gym, builds muscle mass, their muscle mass is going to be a lot heavier than somebody who has a lot of fat, because muscle weighs more than fat. So it can be a little misguiding. Blood pressure checks, we used to use higher guidelines. Recently, we have lowered in the cardiac world. The goal is now less than 120/80. It used to be 130/90. Before that, it was 140/90. What they found, the American Heart Association and the Cardiology Association, is we were missing a huge opportunity to do early treatment, very similar to what we do for a pre-diabetic. You want to get a person managed and making positive changes before it's at a level where it's had a chance to do damage on the body. So after 14 years of old numbers, we now have new guidelines. Early intervention, whether it be health style management, whether it be medications. Sometimes it's as simple as reading a label on how much salt your diet is putting in. And Jill referred to water pill earlier. What the cardiology nurses call it is an anti-salt pill. Because if you can cut back significantly the salt in your diet to about 1,600 milligrams a day, Oftentimes, we can get your blood pressure managed early on without needing to go on extra medications.
Okay, yep, that's good to know. So the blood pressure 120/80, if some of our viewers haven't seen that number for a while, that's not dangerously low,
No.
is it? Okay, because I had written that some doctors are okay, or maybe I gotten this from you, 130/80, but there are new guidelines. And I'd heard of those new guidelines from a new nurse that's what they were studying, probably for the test they have to take. And I was surprised, but yeah, but not, everybody thinks 120/80 is normal, but actually they want it less than 120/80 are the new guidelines. And like Jana said, if it is about lifestyle changes, we're going to talk about here in a little bit, but we have care coordinators. I always want to remind you of that at every clinic, that you can call the clinic that you go to, meet up with our care coordinators. They have education on, heart healthy diets, healthy eating plans, and whichever way you want to go with that. Just basic information on what we're talking about today. Our care coordinators have some of that information also that can help you. But what are some of the labs that they might need to be aware of that their healthcare providers actually ordering for them? And I don't know if you could talk a little bit about what each one of them would kind of show. I have a little bit of a picture there with the ranges. And
your cholesterol, it has two words. They're called a lipid level when we order it, but what it shows is your total cholesterol level. It shows your triglycerides. It shows what's called an HDL, and how I had to remember it, because I'm not real good with numbers, is happy. H is for happy, so that's your good cholesterol. And L is lousy, that's your bad one. So that's how you can kind of disintegrate between those two. You want your happy cholesterol to be high. The happy cholesterol, or the HDL, is the one that protects your arteries. There are some good fats in this world that we encourage you to eat, like avocados and almonds. Those are healthy fats. Those will actually help raise your good HDL level. The LDL, or the bad, you want to be lower. The target on that screen says 70 to 130. Really, you need to be around 50 to 70 for good heart health, because those are the ones that really clog your artery. That 130, I know that's guideline, but that's getting really high on that number. Your cholesterol, we really want to be less than 200, more toward the 160 goal is where the cardiologist will want you, and that's why they order the statins. Sometimes the diet and exercise do help, but they take some time. And we need to get these numbers down faster rather than later. So that's why medications are often advised. I do heed some caution. There's a lot of people doing supplements right now to get cholesterol levels down. Only supplements that should be used should be under the guidance of your medical provider, because they do interfere with a lot of prescription medications on the market today. And you may actually cause more damage than good if you don't have oversight on that. The triglycerides are another thing we need to get down, because they tend to help clog you up faster. So we don't want that. Another blood test frequently used on those preventive screenings we were talking about is a CMP. That is a complete metabolic panel. That goes from everything from your electrolytes, like your potassium and your sodium level. They can draw magnesium on you, which is another one of the chemicals in your blood that help your heart be strong. It shows how your kidneys are working. It shows how your liver's working. And it's a pretty good screenshot of your current health on the day you come in. For both of those tests, you do need to be fasting, because we need to see what your levels are without food in your body. A little bit of water in the morning with your thyroid pill is okay. But other than that, wait to eat or drink until you have your blood tested.
okay. What about tests that their healthcare provider might order? Again, if they're noticing that they're going towards heart disease or they're having some symptoms, what are some of, if you'll explain some of these tests, and I didn't write everything out. So
Yeah, the top picture is an EKG.
Yeah, and so do these pictures make sense? I was just trying to find a picture that maybe would work. So
they do make sense. The
okay.
EKG is a tracing of your heart. We put electrodes on certain areas of the body, which are the little wires attached to the stickies. That shows the electrical impulse through the heart. We can tell if you have irregularities. We can tell if part of your heart doesn't get enough blood flow. We can tell if your magnesium level's high, if your potassium level's low, strictly about the picture that we get. And we are able to do that here in clinic. An echocardiogram is the picture below that tracing. That's a sonogram of the heart. Two different ways it can be done. One is external, which is where they rub the gel and the probe over the heart. Another one, we give some conscious sedation. We put a tube down the throat. You don't know what's going on. We numb your throat and give you some good drugs for it. And it shows how the heart's functioning with a better view. It can show whether you've got an opening between the top two areas of the heart. That makes you more prone for migraines, also makes you more prone for a clot. We can show exactly how well the valves are working, which are the areas between the vessels of the heart. Good test. Used to do a lot of those at Union. A stress test is when you're having some discomfort. The one on the left is a stress test where you walk on a treadmill. The exercise itself really stresses the heart, and that gives the doctor a picture similar to the EKG tracing before of an area of the heart that might not be getting enough blood supply. We all know not all of us can walk a treadmill. Some people have leg trouble, can't walk well, get short of breath, have COPD or lung disease. If that's the case, sometimes the doctor orders what's called a Lexa scan or MyView. You lay on a table, they give you an IV. They give you medicine in the IV that stresses your heart the same way the treadmill would. You get basically pretty much the same results. If there's an area that looks like you've got some difficulty, usually you're advised a heart cath, where they put a tube through the groin, they take pictures, and it can show whether you have heart blockage or not. The test on the right, I'm not sure what they're checking there. It looks more like a chest x-ray than
well, I put in a stress test, or I put in the nuclear stress test because I thought that's what, and these kind of came up, and I saw the ones where they're laying down, and I like, okay, I don't know which one. So, yeah. But I definitely wanted to point out that not everybody had to be on a treadmill. They do the other where they induce it, and you don't actually have to get on the treadmill. I don't know. Is there one that's better than the other? Because I know some people, have made comments about mainly the nuclear one to me, but I didn't. Or is there one, or do they both do the same thing? They're pretty equal in the information they're going to get.
Pretty much depends on which cardiologist you go to. There's some theory that some are certainly better for someone who smokes. Sometimes doctors will recommend one over the other for females because females a lot of time get some areas of concern that aren't really anything to worry about. So that's a question for your cardiologist or your healthcare provider, which one they feel is best for you at the current time.
Yeah. All right, so the big question, what can we do to avoid all of this? We've learned a lot about heart disease, but our goal should be, what can we do to avoid it?
Prevention.
Okay.
Prevention 101.
So changing some lifestyle or making lifestyle changes. What does manage your ABC mean to you? Because I use this for other things for diabetes, but I saw that you used it in some notes.
Yeah, and in the heart failure world, ABC, if you're diabetic, get your regular A1Cs. Get your blood pressure down to target and manage your cholesterol. And by all means, if you smoke, try your best to quit. We do understand smoking is more addictive than heroin, but it can be done.
Yeah, and you mentioned the care coordinators, but also I don't know if our addictions works with, I thought it did, with people who are trying to stop smoking. So we have that here at Valley Professionals. Our care coordinators can get you some information on that, or I'm sure your provider and their nurse can also. Some lifestyle changes you have control over. Getting more active. Exercise is always a good thing. And I know a lot of times I'll have patients who tell me they can't exercise, you know, whether they're not able to get out, but we all as care coordinators have talked about, you know, chair exercises or just things you can do even in the house. But talk more about the different kinds of activity, I guess, that's good for our heart.
Always under a physician advisement. I have to put that disclaimer in there because heart patients don't do much exercise until the doctor tells them they can. But aerobic is brisk walking. You should be able to go for a walk, carry on a conversation, not get too short of breath, but work up enough where you feel your heart beating a little quicker. That's what gets your heart more in shape. Treadmills, you don't have to run. Go for a leisurely walk on the treadmill while reading a book, listening to music. Swimming is an excellent activity, but you have to swim. That doesn't mean you get on the floaty and you get a cocktail and you just kind of hang out in the sun. You have to actually do the swimming. Biking is an excellent resource. It does well with people who have breathing trouble because it doesn't do quite as much oxygen need as the walking or treadmill does. And for those of you really ambitious, tennis. I'm terrible at tennis. I wouldn't be able to breathe, but some people enjoy that. Resistance training, you need to add to the aerobics. That can be anything from free weights to resistance band, which are those stretchy things that look like rubber bands, push-ups, squats. A lot of our patients grab your can of soup that's really high in salt. So kind of read the label while you're at it and do some free weights while you're watching TV with a can of soup. Stretching, it not only helps your body be more flexible, but it really lowers your stress and blood pressure. Things like yoga or Tai Chi. Even if you sit in your chair at home, which my partner Caitlin's here next to me, if everyone say hi to Caitlin, every morning for the last couple of weeks, my stress level's been up. So I've been doing my video on relaxation music. You play that, you feel your heart rate come down, your mind gets a little more clear and you're able to face the day a little better. Very good for your heart and for your overall well-being.
Okay, good ideas, yeah. And I know I either talked about this in a previous presentation, I don't know that it was January, but I know yoga was a big thing a few months ago in the diabetic journals. Yeah. And I even had patients who just will watch a video from YouTube or whatever on yoga. So they don't go somewhere, even though we do have a yoga studio in Rockville now. They just like doing it at home, and they have seen huge changes in blood pressure, blood sugar. And I'm like, just by doing yoga, I haven't tried it yet, but so don't think that you have to go join it, or go to a place that actually does yoga. Download a YouTube video, watch it for a few times, see what you can do, go slow, take your time, check with your doctor, but literally just some stretching and flexibility can help too, especially elderly. As we stop moving as much, we start losing even the flexibility. So you don't have to go out and go for a brisk walk every day. You can just do some stretching, do those the resistance training with, just like Jana said, a canned good. So you don't have to go out and actually buy huge weights.
Our weight loss that Caitlin and I work with a lot, we tell people, if you're watching a 2-hour movie, about every 10 minutes they have a commercial, get up and walk. You're going to be amazed at the end of 2 hours how many times your feet have moved, how many steps you've made. But don't go to the refrigerator. You can go get a glass of water, go to the bathroom, etc. But get up and move. Even that amount of time is going to reap benefit on your body.
Okay, and another thing that I know can help, because you've mentioned weight, is diet, and or just giving our body what it needs, those healthy fats. I put a few things up there, the Mediterranean diet, as a way of looking at whole grains and less of the red meats and sweets and more of the vegetables and fruit. I like how the Mediterranean diet puts exercise and physical activity and family time kind of at the beginning. Definitely that's an important part of every day. And then we use the MyPlate sometimes as we educate patients. I use a lot of the low glycemic food choices because there are better choices in the fruit category, such as an apple is better than watermelon as far as how it affects your blood sugar. What other ideas, any other ideas you can add? I know there's like heart healthy diets and stuff like that. I just didn't add that in, but anything else you can add to what they could do to have a healthier eating choices?
Well, significant time goes into this topic because people like to make excuses. It's easy to make excuses. They say McDonald's and your fast food is cheaper than a good salad. I get that if you're in a hurry, but if you can go to the grocery store and buy a big tub of lettuce for $5, that's still less than one meal at a fast food restaurant. If you can drink soda, you think of the empty calories, the carbs, the sugar that's in a regular soda, and then you refill it 2 or 3 times, you're really not saving money. Water is still free at home most of the time. Cardiac diets, the main difference is we really want to watch the fat. We want to watch the red meat because those are the things that really tend to clog the arteries faster and raise those cholesterol levels. So anything you can do lean, which not everybody likes fish. I'm one of those people, not a fish fan, but I do eat pork. Pork can be very healthy. And I tell our patients, think about how your grandparents ate. Your grandparents didn't go to the pantry, get 3 boxes of fast food or a hamburger helper, something like that out. They either killed it, they grew it, or with sparse money, they were selective on what they did buy. Meat back then was not as fatty as it now because it was more grass-fed than grain-fed, so it was healthier for them. And their workday was full of that physical activity and family time listed below. My one caution, the low-fat products on the market taste terrible. If any of you find one that tastes better, let us know because we've really been working on that. So my husband, who has high cholesterol, we've been watching. I've got him on low-fat everything, and he throws a fit. So he's taken to trying to spice it up. A little cayenne pepper, a little parsley, some kind of seasoning he has up in the cabinet, and he's made some really creative, tasty things. And then he's taken joy in part of that solution to his problem. So work it out together, make it a family intervention to get the whole family healthy, because what adults put in their mouths now, their children are also learning those behaviors, and there's no better time than now to change that.
And just a reminder, like I said, we have care coordinators at every site that if you're interested, contact that site you see your provider at, and they will be glad to meet with you and talk more about healthy choices when it comes to food choices. I don't usually use the 4-letter word diet. I try to avoid that. And here I used it. I see like I'm losing it. But really, I'm trying to not call it that because it's not about going on a diet and restricting yourself. It's making healthier choices. It's finding what is actually better for you and giving yourself more of that, not limiting it, but more of the good things, healthy things. So sometimes, even though you've exercised and you've changed your lifestyle and you're eating healthier, sometimes doctors, healthcare providers still want to put you on a medication. What are some of the medications that a patient might be prescribed, and what can you tell us about them?
Now on the screen, we've listed out the main 4 at the top that we use in the heart realm. Beta blockers cause your heart to beat more slowly. That's why people on beta blockers sometimes get what we call bradycardia or a low heart rate. That's what those medicines are meant to do. That lowers the force of blood that goes through the vessel's walls. It can lower your blood pressure. It can make more blood get to those vital organs. Just has to be monitored by the physician to make sure you're at the right dose. ACE inhibitors relapse arterial walls and veins. That really has an impact on your blood pressure. When you first start these 2 classes of medicine, you'll feel a little off. You'll feel a little weak. You'll feel you don't have quite as much energy. That's the body getting used to it. That does not mean you stop it. That means you call the I'm having these symptoms. Usually they have you watch it for another week or two and those kind of level out. Otherwise, it's a follow-up with them to discuss an alternative. Aspirin is a potent medication. People think they can just pop it, but it stops platelets from clumping together. When that happens, you don't form a clot. So people who are on aspirin therapy have an increased risk of bleeding. You'll know that if your tooth comes out, if your nose starts bleeding, if you get a cut. So again, it really needs to be under your healthcare provider's guidance. Anticoagulants are different than aspirin because it keeps clots from forming. These are the medications we use when you're at high risk for a stroke. If you have a blood clot in your lung, your leg, your arm, somewhere noted. Xarelto is one name, Coumadin or warfarin is another name. There's several different ones on the market right now. And your doctor will choose the best one for you. Sadly, it's often dependent upon what your insurance will allow. Insurance likes to dictate what medications we're able to prescribe. Coumadin can be a relatively inexpensive drug, but it requires close monitoring and change in your diet to make your levels as beneficial as possible. The other medicines, you don't have that monitoring or dietary change, but they can be anywhere from $200 to $1,000 a month if your insurance doesn't want you to take it. So those are the main medicines I deal with. Jill does the diabetic.
Yeah,
ones.
and you had mentioned in the handout, like I said, that's going to be posted, that there were some diabetic medications that also they have a secondary, they can help with the heart disease risk. They weren't created for that reason. They were created for controlling blood sugar, but after years, they noticed of people taking it, they also noticed a heart benefit. And the SGLT2 is one of those categories of medication, and the medications that you may have heard of in that area are Jardiance, Invokana, Farxiga. There's a few more, but those were the main ones that a lot of our patients are on. And then also the GLP-1s have been found to have some heart health also. Again, their main goal is to help with blood sugar, but they're seeing that secondary benefit also. And in that GLP-1 class of medications are medications like Victoza, Ozempic, Trulicity. So those are some of the names you may have heard. So I just always like to make sure we have some overall idea of information of what some of these terms your doctors might be using, whether it's the kind of medication, the name of the medication, or like we went through the beta blockers or the ACE inhibitors. Those are names your doctor might use, but those are classes of medication that they may actually prescribe if we can't get high blood pressure or heart disease under control any other way. So are there any questions or comments? I haven't noticed anything come up, but Haley, do you have anything that anyone's written?
No, I do not.
She unmuted and muted. I do have the resources if anybody wants to, and I just am almost refusing. I can put these in a APA form or whatever, but I hate doing APA. So I'm just like kind of listing the source, and I put a little bit of like the American Heart Association and that risk estimator for your cardiovascular disease. I just put kind of a blurb of what it is. And then the Mayo Clinic, CardioSmart, and the CDC. So I just put the websites. Once you're there, you can actually just go around and actually just kind of search around in that area and put in a search for heart disease or heart disease and diabetes or just diabetes, and you're going to get all kinds of information.
Hey, Jill, we have a question.
Once you start cholesterol medication, does it mean you're on it for life? Absolutely not. Just because you start a medication, if you're able to do good lifestyle modification, your body can very well improve your numbers and you can go off medication. We have seen it happen time after time. Same with blood pressure medications. Just because you start doesn't mean you have to stay on it. Those lifestyle changes really can impact the amount of medications you need to be on. And on a side note, I did want to mention, right now we've got a pretty big problem in this community with vaping. Vaping directly affects the heart. We're seeing it in teenagers, we're seeing it in athletes. So if you know anybody who is vaping, vaping does two different things. The nicotine in it raises your blood pressure and it increases the adrenaline, which is the chemical your body gives off, that flight or flight response where your heart rate goes up and you get a little anxious. That's adrenaline, and those are both affected by vaping. So speak to a healthcare provider and let's get those behaviors stopped.
No, I'm glad you brought that up. Yep. Yeah, and I think that's true too for diabetic medication. A lot of people ask me that same question. Once you start on something, can you come off of it, specifically insulin, because they don't want to give injections? And I have had a patient do that, and it was done because of lifestyle changes.
Right.
I mean, research has shown that if you can get your weight down by 7 to 10%, I often say 5 to 10% because it's easier for me to do the math. You take 10% of the weight and take half of it, but 7 to 10%, whichever one you want to go with, they have found lower blood pressure. It can lower cholesterol and lower blood sugar. So it's a small goal to actually set. It doesn't have to be overwhelming. All right, so thank you everybody for attending. And if you have any other questions, you can always call the offices and ask the care coordinators. I encourage you to use them and me if you want to meet again for more education.